yesterday. On December the 24th, we had 198 patients in all of our local hospitals. And as of yesterday, we had 352. That was an increase of 77.7%. And we've also seen increases in COVID in our jail, and Sheriff will be here today to talk to you about it. Never before during this 2-year pandemic have I had so many family members and so many friends come down with COVID. It is spreading, and it's spreading fast, and I think it'll probably get a lot worse before it gets better. Mayor Nierenberg and I have been talking each day. As you know, we cut a media spot encouraging people to use safety measures. And we thought it was a good idea to tell and show to the people of San Antonio in our area exactly what's happening at University Hospital and probably happening at the other hospitals. So I asked Dr. Brian Alsup, would he come and relate what he has seen and his advice, as well as Tommy Austin, who is the nurse executive, and Sheriff Salazar, for what they're seeing, to give you a first-hand account of what's happening and to give you their advice. After they do that, then Mayor Nierenberg will wrap up, and we'll be glad to take any questions you have. So Dr. Brian Alsup, please.
Well, thank you, Judge. Indeed, once again, we're facing stress on our healthcare system due to increased number of infections, and this time from the Omicron variant. These cases, even if they're relatively mild clinically, are exacerbating the staffing challenges that hospitals face. We've seen hospitalizations of COVID patients, as the judge just said, increase over 75% during the past week, while at the same time we're focused on providing care to patients with many other illnesses and injuries. We're asking everyone to help us preserve our capacity and allow hospitals to care for more patients that need treatment for things like trauma, heart attack, strokes, and other serious conditions. If you develop COVID symptoms, please call your primary care provider for instructions on how to get tested, or use one of the community testing facilities available. Emergency departments are not the place to seek COVID testing. This latest variant clearly is very infectious, and reducing the likelihood of transmission should remain everyone's priority. We know what works. Getting vaccinated and getting a booster when eligible. Wear masks when gathering around people outside of your own household. Face coverings, when worn appropriately, remain effective. Wash your hands and maintain some physical distance from others when you're in crowded indoor settings. Unfortunately, there are individuals who remain at high risk simply because they cannot be vaccinated, such as children under the age of 5 or people with compromised immune systems who may not respond as well to the vaccines. Across the country, hospitalizations of children for COVID are also rising. Their defense against this pandemic depends on properly worn masks, physical distancing, and being surrounded by people who are immunized. Locally, we are continuing to see the effect of coronavirus spread in recent weeks, but we can still mitigate the additional impact that New Year's will likely bring. Unpopular but safer choices include skipping in-person parties or get-togethers outside your household while still remaining diligent with prevention measures. Please consider that and do your part as you make decisions for yourself and your family. Help us ensure that we have the sufficient capacity and more healthy staff members to care for those in need, whether it be for COVID or other serious medical conditions.
Good morning. As a chief nurse, I make rounds in the hospital, and as I make these rounds, I see nurses who are working diligently to take care of patients using personal protective equipment for patients with COVID-19. But most of all, I see nurses who have been day in and day out working tirelessly. We have seen such a surge with Omicron in that our nurses are having to work overtime and take care of each other, and they're also getting sick. And not just our nurses, our food service workers, our EVS workers, respiratory therapy, and our physicians. And so what I'm asking all of our healthcare workers is to make sure that when you're out and about, you wear your mask, protect each other, be a good citizen, and make sure that it's not just about you, it's about everybody. And that's why it's so important for us to wear a mask in public. One of the things I'd like to stress is that, you know, make sure the distancing, social distancing, and hand washing. But also, we've been working really, really hard, and I want to say thank you to all of the nursing staff who have not had holidays for the last couple of years because they've been working, and to all the healthcare workers who have been working hard, and especially to the emergency room because they have really, really seen an uptick in patients. And all of my leadership team in the emergency room was working when Judge Wolf was talking about the other day. They were all working till late hours taking care of patients. So I just want to say, please make sure that you work diligently to take care of each other. And I want to thank the healthcare workers for everything that they do every day.
I'd like to reiterate that. Just a huge thanks to our healthcare workers and our first responders that are out there. Despite this pandemic that just we can't seem to shake, they're out there getting their job done with honor, the way that you know we would expect them to. You know, the reason we came up is we absolutely knew that the holidays were going to be we were going to see a boom in this illness after the holidays, and we're well in the midst of it, and we also know that it's going to get worse before it gets better, unfortunately. Now, I can give you some perspective from the part of the jail and from the part of the sheriff's office. You know, we consider the jail to be kind of a microcosm of what's going on around us on a daily basis. With 4,000 inmates on any given day, we can pretty much gauge what to expect in the community at large based upon what we're seeing within the jail. At the jail, you know, we've had our ups and our downs. We are testing everybody still within the jail. We're still following an aggressive cleaning schedule, and we're still ordering PPE on a daily basis throughout the jail setting. With that being said, just a few weeks ago, late November, we were down to one inmate that was COVID positive, and the number of our deputies was down in the single digits, also in late November. After that, we've seen a pretty steep increase in those numbers. So as of today, we've got 38 COVID positive inmates in-house. Now, some startling facts about those 38 COVID positive inmates. 25 of them we know came from outside the jail already infected. They came from the streets already infected. They were interacting with you and me at the grocery store, at the movie theater, or wherever it may be, just moments before they were arrested and came in with it. Of those 38 also, 25 are completely asymptomatic. And so we can tell you that you know, chances are if you're out venturing out into the public, you're going to be, whether the person standing next to you seems to be just fine, they could be carrying this illness that, again, just as a reminder, we've all heard it dozens of times. Just because somebody looks to be completely healthy doesn't mean they can't be giving you something that you could then be taking on to a relative or passing it on to somebody else in the public, and it could have much worse consequences for them. As far as our deputies go, at present we've got 50 deputies, or 50 employees, civilian and sworn, that are COVID positive. We have 93 currently out as a result of the illness, but also as a result of having been exposed. I can tell you that through our contact tracing efforts there internally within our deputies, within our employees, of those 50 employees that are COVID positive, we're fairly certain that the vast majority of them caught it off duty, not within a jail setting. So many of them report having been exposed to either a sick child or a sick relative at home. So again, just as a reminder that we're out here, we're getting our job done, but we just want to use this as the opportunity to remind everybody, continue to use your distancing, continue to use your hygiene and your PPE. It's all important. Thank you all so much for having us out today. Happy New Year to everybody. Después.
Let him finish.
Good morning, everyone. And first, my thanks to Judge Wolf, the county, and all of our healthcare workers in the community. The theme of this entire last few years has been about teamwork. San Antonio faces some very difficult challenges when it comes to dealing with a pandemic like this. But through teamwork, we've been able to save lives and get each other healthy again. And as this has ebbed and flowed, we find ourselves here again, and teamwork will be called on once more. So as we enter the third year of the coronavirus pandemic, it remains important for us to continue practicing safety precautions to reduce the spread of COVID-19. And although we are confronting yet another surge, this time we have more tools than ever to fight it. Vaccinations, improved treatments, testing, and a better understanding of what we're up against. We are in a different situation than previous surges, largely because of vaccinations. Some 75%, roughly 8 out of 10 patients in our hospitals yesterday for COVID were unvaccinated. Let that sink in. We're approaching nearly 7 to 8 out of 10 San Antonio Bexar County residents who have been vaccinated, yet 8 out of 10 who are in the hospital for COVID are unvaccinated. That should tell you something. And as San Antonio and Bexar County residents are vaccinated at higher rates, we are higher than the statewide level. But we still face risks as we move into 2022. The Omicron variant is highly transmissible, so I urge every San Antonian to embrace safe behavior to help us get through the Omicron surge as quickly as possible and thwart the spread as we move forward. Omicron, and we hope this continues to bear out in the data, is not making people as sick as in previous COVID strains, but my office has confirmed that University Health's peer hospital systems are suffering from the same stress on staff. Please get vaccinated if you have not done so, and get your booster shot and mask up. If you're sick, stay home. One way to help your friends and neighbors is to avoid putting them at risk. And if you're going to the outdoor New Year's Eve celebration downtown tonight, take precautions. The CDC guidance calls for masks at indoor events, but you can give yourself and others added protection by wearing a mask outdoors as well. If you're planning to gather with people outside of your household, reconsider it, or consider using a self-test or getting tested. By practicing these tried and true health measures, we can all kick off 2022 in a safer way. And if you get COVID, you can give it to your family and friends and those you're in contact with. So let's help each other in our community by taking common sense precautions to help prevent COVID spread. Remember, and this is important because this has been twisted, you can still catch the virus if you're vaccinated, but the vaccines are offering protection against severe illness and hospitalization, and the big bills that hospitalization comes with, not to mention the burnout that we're facing in our healthcare industry. And I just want to close again and say, by the way, we are doing everything in this community to get more folks vaccinated. That remaining 20% or so that has been holding out, we still have plenty of time, or plenty of opportunities to get vaccinated. And I also want to mention Metro Health still has plenty of HEB gift cards for those of you who have not completed the full series yet. You can get your Metro Health vaccine site and a $100 gift card upon completion of your vaccine series. So we're all in this together. This has not changed. Let's continue to fight COVID together, and let's have a great 22. Happy New Year's, everybody.
Let me just add a couple of things, and we'd be glad to take questions. Number one, Wonderland, we have the mass vaccination site that UHS is running. We're giving vaccinations to people maybe that didn't even have them, and those that are getting boosters. One of the problems that we have, while we have a high vaccination rate, not enough people are getting the booster. You got to remember, when you get the vaccination, as time passes, it begins less effective. So after a 6-month period, you need to get that booster. And let me tell you, if you got any love for children in this area, and parents' love for their children, they better get vaccinated. Dr. Bryan also mentioned how many more children were going in. Just from December the 22nd to December the 28th, nationwide, 378 children every day are going into the hospital. And according to the chief of the Children's Hospital of Philadelphia, every one of their patients. Their parents weren't vaccinated, and the child was not vaccinated. So if you got any love for children, and I hope you do, get a vaccination to protect them. And if they're eligible for vaccination, get them a vaccination also. The mayor outlined all of the other safety measures you should take. Let's continue to do that, and with that, we'll take any questions you got.
Judge, we've done multiple stories throughout this week that it is so difficult to get a COVID test right now. They're sold out in stores. If you're going to a place, the lines last for 2-3 hours at a time. You're asking people to get tested, but it's New Year's Eve and it's next to impossible to make that happen.
Well, I know that's a big one. And a lot of drugstores are running out of the COVID test. And to take a COVID test at home, Tracy, we bought some and we take it at home, and we found out we were negative. So getting that test is important. I saw a picture in the Wall Street today where there were lines and lines of people waiting to get tests. Now, President Biden has said we're going to get 500 million test kits. He really needs to move a heck of a lot faster because there is a limited supply. The city of San Antonio has several different places you can go. But yes, it is somewhat of a problem, and we do need to get more test kits going. And the federal government needs to get them out here and get them out here as quick as possible.
Are we looking to expand any kind of testing out throughout the city?
Well, Mayor Nurnberg City is doing some of those now.
Yeah. Well, let me just say first that there is a lot of capacity at our curative sites. So please go get tested at one of the free testing sites. Now, if you're talking about the rapid tests, there's a nationwide shortage, but we in the health department are taking steps to acquire more tests and get in line to procure more tests ASAP for this community. So this is a challenge nationwide, but we're not resting. We're working to get more rapid tests in the San Antonio community as quickly as possible.
During the holiday, today, tomorrow, and Sunday, is testing at the curative sites and other city sites still going to be conducted along with vaccinations?
Yeah, the testing sites will be open. The normal hours of testing sites will be open, and again, can't emphasize enough, there's plenty of capacity in those testing sites.
Mayor, why has the city not canceled the New Year's Eve celebration? Given the severity that y'all are stressing, why is it still going forward where, tens of thousands of people are expected to go downtown tonight?
Again, it's not about any particular place or any particular gathering. We know that there's going to be gatherings all over the place, all across this country. But what we want to focus on is making sure people have the proper safety precautions and are taking this seriously and using the tools that we have available to us. If we're able to do that, we can move forward. Omicron is highly, highly transmissible. And in order for us to break that chain, we're asking people to wear masks, don't gather in tight crowds with people outside of your neighborhood or outside of your family. And again, get vaccinated. We have the tools at our disposal. Remember, at this time last year, nobody could get a vaccine. I mean, we had one level of eligibility. We've had vaccines available to the point where we're incentivizing people to go get them. And what we're seeing in the hospitals now is a result of people holding out and not using the tools available to us to end the spread of COVID.
People who do end up going to tonight's celebration, any suggestions for how they can avoid getting?
Absolutely, yeah, and I went through some of those earlier. Number one, again, this is, if you haven't already gotten vaccinated, get your booster. Number two, a mask. If you're gathering with people outside of your household, a good quality, well-fitting mask is critically important right now. Even if it's outside, wear a mask. And then again, if you are symptomatic, if you are sick, stay home. Don't come downtown. Don't go to a friend's house. Stay home and protect themselves and yourself.
If you don't see the numbers subside anytime soon, where do you see us going in the near future or even beyond that?
I would guess that what we will see is that we're going to need more imported nurses. I believe that we've been allocated about 411 that could be in the San Antonio area. So I would think that that's going to be necessary, because you got to remember the healthcare workers are almost working around the clock. They get sick just like everybody else gets sick. It's a big danger to them. And so we're probably going to continue to need some outside help just to make sure that we can handle whatever rise we may have in hospitalization.
On that outside help, have either of you had any conversations with the governor? Has pledged any support? He hasn't really seemed to mention anything about the fight that
Well, he's been rather quiet, needless to say. But I think through the emergency department of Health and Human Services, I believe NIMKID coordinates it, and Eric Epley was just saying we were allocated 411. I don't know whether they're on the ground here yet or not.
You got 411 nurses?
Yes.
And when do you expect those to...
Well, I'm not even sure are they here yet, Brian? No, they're not here yet, but Monday, we think they'll be here Monday.
And is that just at university?
No, I think that's all the hospitals, all the hospitals.
So when you say region, is that Bexar County or is that around, or is that surrounding as well?
For Bexar County.
Okay.
Question for Dr. Alseder. The Omicron variant appears to be significantly less severe for people. A lot more people are catching it. Do you have any optimism going into the new year that we could be getting closer to herd immunity with so many more people getting sick and then recovering?
Well, I don't think we have enough information yet. We don't know essentially how much natural immunity from Omicron protects you any more than the previous variants. I'm not optimistic about the numbers that we're seeing, even though we certainly have seen that it's clinically milder or more moderate than some of the previous variants. It's extremely transmissible, and even a small percentage of individuals who are ill out of a large number of people ends up being a large number of people that can get ill and end up in the hospitals.
What do you say to those out there who are chime in and saying there's not a lot to worry about, Omicron isn't as bad? What message do you have to say to them? And if the rest of you want to chime in as well, feel free.
Well, again, I think you shouldn't let your guard down. There's so many things we don't know. As I mentioned earlier, there's plenty of people who haven't been vaccinated who are at high risk. There are a lot of people who can't get vaccinated who are at high risk. Those are susceptible to severe illness. We are already just learning now, 2 years into the pandemic, what the effects of long COVID are. Just getting this infection could saddle you with all sorts of health conditions for a long period of time that I don't think most people would want to take that chance. So there's a lot of reasons to do everything you can not to get infected.
Again, I don't want to be over pushy on this, but the unvaccinated are in danger. I won't say who it is, but I got a family member, young, 40-something, not vaccinated, came down with it, 103 temperature, very dangerous to a lot of people, depending on what their underlying health issues are, whether they're vaccinated or not. But the unvaccinated have driven this pandemic, have driven the Delta pandemic. 80% of them of our hospitalization are unvaccinated. So I would say to you, if you got an unvaccinated friend, try to talk them into getting it or stay the hell away from them.
Since the judge mentioned the vaccinations, the Sheriff's Office is partnering with Commissioner Justin Rodriguez, and we're in the process of planning with the Texas National Guard a pop-up immunization next Tuesday at the jail, 200 North Comal. It'll be a drive-through event, so we'll be opening up the gates to the jail, and we'll be releasing those details on that event later today. I believe Johnny will be putting out a press release and putting it on social media later. But so we'll have the hours and updates available later today. Usted estaba pidiendo información en español. Pues nosotros obviamente queremos dar números de lo que está pasando con nuestras organizaciones y agencias. Sabemos que en mi departamento ahorita tenemos de 4,000 reos que están en la cárcel, 38 tienen COVID. Hace unas cuantas semanas que solamente teníamos un reo que tenía COVID, pero ese número fue incrementando muy rápidamente y ahora tenemos 38. De los 38 sabemos que 25 de ellos entraron a la cárcel ya con COVID. Entonces eso quiere decir que en los momentos antes de ser arrestados, ellos estaban en la comunidad, y también de esos 38, 25 no tienen síntomas. Entonces, eso nos quiere decir que si nosotros estamos fuera de nuestra casa, en la tienda, en el teatro, donde sea, nosotros estamos cerca de personas que tienen la enfermedad, aunque no parezcan.
Is there any data on people who have been reinfected? Does the hospitals have data of whether or not somebody was vaccinated? But is there any data to show that someone maybe has a second infection of COVID?
I don't have any specific data on that, but relative to Omicron, but you know, we have seen over time that there is some protection from natural immunity, but we've also seen historically that that wanes even faster than the vaccine protection. And so it's not something people would count on necessarily to protect them against future infection, particularly as we know this virus can change, and the variants that we're seeing now have become more infectious and therefore might be even more likely to infect someone even if they'd had previous illness.
That concludes the press conference for the moment, but we're going to be available for one-on-one interviews, and we have a Spanish-speaking nurse available as well. Thank you.